Light periods, also known as hypomenorrhea, are common and can be experienced by many women at some point in their lives. In their late 30s and 40s, people may develop heavier and shorter periods. They may also have months without periods and then have a heavier period later. In this video, we will talk about this disease, hypomenorrhea, by answering these questions. What is hypomenorrhea? What causes hypomenorrhea? Symptoms of hypomenorrhea. How's it treated? What is hypomenorrhea? Hypomenorrhea, or hypomenorrhea, also known as short or scanty periods, is extremely light menstrual blood flow. In some women, it may be normal to have less bleeding during menstrual periods. Less blood flow may be genetic and, if inquiries are made, it may be found that a woman's mother and or sister also have decreased blood flow during their periods. What causes hypomenorrhea? There are several reasons that can make your periods scanty/lighter, or even reduce to the level of just spotting, including your age, body weight, contraceptives being used, current medications if any, etc. Age. Period flow can vary throughout a person's lifetime. When a person first starts their period, for example, their flows are usually lighter and may only involve spotting. Periods tend to become more regular when the person is in their 20s and 30s. In their late 30s and 40s, people may develop heavier and shorter periods. They may also have months without periods and then have a heavier period later. Periods often then become lighter and more irregular during perimenopause. However, if a person who used to have regular periods suddenly noticed skipped or missed periods, they should see a doctor. A lack of ovulation. Sometimes, a person has irregular periods because their body does not release an egg. This is known as anovulation, and it can lead to lighter or irregular periods. Additionally, some people have primary ovarian insufficiency. This refers to when their ovaries stop functioning correctly before menopause. Body weight changes. People who are underweight or who quickly lose a large amount of weight may notice that their periods are very light or that they stop altogether. This change happens because their body fat level becomes too low, which can stop ovulation. Excessive exercise and eating disorders can also cause a person's periods to become lighter or stop altogether. Pregnancy. During pregnancy, a person's periods will usually stop. However, people may mistake implantation bleeding for a light period. This is a light amount of spotting that happens when the egg attaches to the uterine lining. If a person has spotting after a missed period, they may wish to take a pregnancy test. Medical conditions. Certain medical conditions that affect a person's hormones can also affect the menstrual cycle. These conditions include thyroid dysfunction, polycystic ovary syndrome, PCOS, perimenopause, Cushing syndrome, stress. Extended periods of stress can affect the body's hormones, which can interrupt the regular menstrual cycle. Taking steps to manage stress can help a person's periods return to normal. Symptoms of hypomenorrhea. Usually, a woman on an average loses 2 to 3 tablespoons of blood during her menstruation. For some it may be a little higher, and for some, the blood loss may be a little less. Symptoms of scanty periods may include the need to change pads or tampons may reduce significantly. Periods may not last for full 5 days, they may be shorter. Instead of heavy flow during the first 2 days, blood loss may be very light. Periods may be as light as spotting during all 5 days. Lesser abdominal cramps, less abdominal and lower back pain, and lighter mood swings. How's it treated? Unless a significant causal abnormality is found, no treatment other than reassurance is necessary. Otherwise, treatment is determined by the diagnosis of any significant causal abnormality. Can I still get pregnant with light periods? A light period is a period that lasts less than 2 days, and there is very little blood during this time. Light periods do not usually mean that you are less fertile, but it can make it more difficult for you to get pregnant. Thank you for listening to all the information we want to introduce to you in this video. Do not forget to like, share, and subscribe for the HeInfo channel.